Do you ever feel a need to stretch the front of your neck or chest? Or do you feel hunched over and wish you could stand up straighter? Well, if that's the case, then I want you to give this exercise a try. In this video, I'm going to show you how to do the exercise called thoracic and cervical extension. And just like the name suggests, it extends the spine, so it pulls it backwards and lengthens the front of the neck, pulls the head back and stacks it over the shoulders, and ultimately helps you stand up straighter. So it is especially effective because of this one key factor that most exercises that focus on this area miss, which is that it incorporates the hips. And why this is so important is because the head usually follows where the hips go. So for instance, if the hips are tucking under and traveling forward, then the head is going to come forward as well. If the hips are pushed back, then the head is going to come back with the hips. And this is all what your body does to help you from falling over. So if you don't address the hips at all, then you're really not going to get the results that you're hoping for. A good thing to keep in mind when you're working directly on a targeted area is that all those symptoms like the muscle knots and the overly tight muscles and soreness are most often created from uneven use of the muscles. That's caused from misalignment. So those overly tight muscles can actually become dysfunctional. And when they're dysfunctional, then all that stretching and poking and trying to work on this area directly is not going to work. So doing a full body alignment exercise is actually going to get rid of those symptoms all on their own. Before we start, you should always listen to your body when starting a new exercise, but you may want to avoid this exercise altogether if you have any disc issues or pain in or around the spine. To do this exercise, you'll need to sit on the floor with your knees bent, feet parallel, and toes straight forward. Your hands are behind you like a kickstand with fingers pointed straight back. The first thing you want to do is roll your hips forward as if you are trying to point your belly button at your feet. Remember, we include the hips because we're going after the whole spinal complex rather than just one segment in order to change the symptoms in your upper back and neck. If you're not able to do this motion with the hips, then working on this separately would be a good idea. The range of motion doesn't have to be a lot, but you need to focus on holding it the whole time in whatever end range you have. If you find that your knees keep falling out to the side, you can put a block in between them to train those muscles. Next, you're going to push up through your hands, bringing your shoulder blades back and down together as you do a little back bend, pushing your chest out. Next, let your head drop back slowly. This can be a little uncomfortable as it is hardly ever in this position, and there will be work involved to keep it there, but it should also feel like a good stretch. If there's any pain or dizziness, you'll want to come out of it right away. As you settle into this position, do a mental scan of your whole body and take note of what you feel and if that changes throughout the exercise. You may also feel a break in the chain, like your mid-back tries to fold back up or your hips start relaxing, and that's okay, but for the very best results, you have to keep all of these 3 points as engaged as you can the entire time. So just keep reminding yourself throughout the exercise, hips forward, chest out, head back. You want to stay in this exercise for 60 seconds if you can. You can always do more time, but don't be afraid to start slow and do less time and then work some more time in as you get better. You can also do some modifications because this is a lot of extension, and if you're not used to it or it's difficult, then we can start with one of those points. So we can either do just the hips, rolling the hips forward, pointing that belly button towards the feet, and hold that for as long as you can, or 60 seconds. Or you can just do the back and work on that scapular movement and being able to extend the thoracic spine. Or you can just drop the head. And then you can always incorporate one more into the mix and just keep getting better at it, add more time, however you want to configure it. But to get the most out of this exercise, we want to keep all of those 3 points connected. But It's great to break it down as well. Do what you can. And I hope you find this exercise helpful. If you have any questions, I'd be happy to answer them. And I thank you so much for watching. And remember that the more regularly you do your corrective exercises, the more your body remembers them and the more improvement you will see.